Once you diagnose with any disorder, often you will be curious to know how the clinician, either the doctor or rehab professionals, how are they going to approach this disease. Hi, I'm Nikhil. I'm an advanced neuro rehab specialist. I'm here with you today to discuss regarding different assessment scales used in people with Parkinson's disease. The most widely used scale, or we call it as UPDRS or modified UPDRS. So, this UPDRS is composed of 4 sections. The first section is about the mentation, the behavior, etc. Means how is your behavior, what are the mental related problems you have in a day-to-day activities. The gold standard in assessing people with Parkinson's disease is something called UPDRS, or Unified Parkinson's Disease Rating Scale. It has multiple versions, version 1, version 2, version 3. So, it has 4 sections. The first section is the mentation, behavior and mood. How is your mood? How is your behavior during the disease? We have already discussed before that as a disease progresses, people can develop some kind of cognitive deficits. They can have problems like hallucination, they can have anxiety, depression. A lot of psychiatric illnesses can coexist with Parkinson's disease. If you have not watched that video, you can click on this link to watch the complications related to Parkinson's disease. The second one is the activities of daily living. How active are you in your day-to-day life, even if you are diagnosed with Parkinson's disease? The third section, or motor section, primarily deals with the motor complications related to Parkinson's disease. If you have not watched that video, you can click on this link to watch that video and come back. The fourth section is the complications because of the therapy. Means some people can develop some kind of dyskinesias, some kind of other problems with dopaminergic agonistic medications like Syndopa. The fourth section is primarily dealing with that. So, this is the primary scale worldwide people uses, and this is the same scale we use during the Levodopa challenge test. If you have not watched the Levodopa challenge test video, again you can click on this link where we will explain what is Levodopa challenge test and how it is performed. The other assessment scales can be classified motor assessment scales like modified Horn and Yahr scale. Again, this is not a scale as a scale, this we use to stage the disease, how much the disease has progressed, we use that scale. Another scale that we use is abnormal involuntary movement scale, or AIMS. Another method we use to assess is we ask the patient to make their own diary of the motor fluctuations. Usually patients say, I am better in the morning, I am not that better in the second half. So, these feedbacks are important in assessing the people, assessing the motor problems related to Parkinson's. The second set of scale is related to their cognition and their mental capabilities. The first scale to understand the mental functions is something called mini mental state examination, or MMSE, and often people develop depression along with that. So, you can use different assessment scales that usually we use for depression, and you already know dementia is part and parcel of the disease. So, scales like dementia rating scale also widely used in assessing people with cognitive deficits. The next set of assessment scales that usually we use to understand the other non-motor functions. There is something called non-motor self questionnaire. This is also commonly used to identify the non-motor aspects of people with Parkinson's disease, like olfactory loss, like hallucinations, like depressions, those kind of stuff. The last category of assessment scales, and I say the most important category, these are the things to assess the quality of life. These scales will tell you how active or inactive you are in your day-to-day life, and how well are you able to take care of yourself. And a disease like Parkinson's disease, the quality of life has to be the paramount importance when we coming to the assessments. Yes, people can have rigidity, people can have tremor, people can have problems, but at the end of it, when do you need to take an intervention is when that start affecting your quality of life. So there are different assessment scales people use. Some simple scales like functional independence measure or modified Barthel index. So these scales you can use to assess how much their quality of life is impacted because of the disease. Yes, we have discussed a lot of assessment scales we use in Parkinson's disease. Don't worry, it is not your headache, it's our headache to assess you correctly, make a report and help you to improve your quality of life. If you want to know what is the direction of your disease, how much it has progressed, or what all complications you have related to this disorder, please contact us on the number given in the description and connect with us. We are there to help you, to make you understand how much the disease has progressed and what we can do next. Always there is a hope. Thank you.